Hey, Matt.
Hey, how's it going?
It's going really well. Thank you for joining us today. Everybody, this is Matt Musick, our PA guest today. Matt, it's really wonderful to see you. We've been talking all about PAs so far, and so why don't you tell us, give us a little bit of info on your journey into the life of a PA. We understand that you were an RN first, and then went to PA school. Tell us about what was that all about? Why did you make that decision?
So I started as an RN, but I felt that wasn't enough for me. I wanted to do more. So I decided to go into PA school, and also I wanted to work in surgery. So I applied for PA school and got into a program. And I think it's one of the best choices I've made. So
that's awesome. That is awesome. And tell us about PA school. What was PA school like?
My program was 34 months, which is one of the longer ones, but it was 3 years. So the first year was, didactic learning in the classroom. You're learning anatomy, physiology, you do cadaver lab. You also learned pharmacology, pathology, all of these, fundamental things. It's basically like medical school, but condensed and a lot faster. So that was the first year. The second year was all like specific systems like cardiology, pediatrics, OBGYN. So all of these specific specialties that you need to know. And then the third year was all clinical rotations. So we had 13 months of clinical rotations. 2 of those were surgery. So I did general surgery, and plastics was the elective that I chose. So I got to do 2 months of plastics plus general surgery. So I felt like it really prepared me to jump into the world of surgery and the area.
Yeah. Now, did you know going into it that you wanted to go into neurosurgery, or was that just sort of happened? Or tell me about that.
Well, originally I wanted plastics. That's what I went into school for. I knew I needed surgery. But that's what I wanted, was to be in surgery. But when I graduated school, I was looking for jobs, and I noticed that there was a neurosurgery position open. So I applied for it because I thought it was interesting as well. And I started working in neurosurgery from that point. That was my first job after graduating, and I've been in it ever since.
Yeah. And how long is that?
So I'm going on 6 years since I've graduated school, and I've been in neurosurgery and spine surgery now for 6 years.
Oh, that's awesome. Well, tell us, Matt, a little bit just generally about what you do on a daily basis. What does your life look like? And I know we've talked before about how different, even within the context of your of the neurosurgery group that you work for, that some of the PAs do different things, and some do and what you do, and then others do more of the surgical part of it, I guess, or whatever. Anyway, you know what I'm talking about. Tell us a little bit about what you do on a daily basis and how that differentiates between different PAs.
Sure. Well, currently I work for a neurosurgery group in Austin, Texas, and we have 2 different kinds of roles for the APPs, which are advanced practice providers, kind of the umbrella term for NPs and PAs. The first role is called a one-to-one position. So basically one of the nurse practitioners or PAs is assigned to one surgeon. So they follow all of the patients for that surgeon. They do the clinic with that surgeon. They assist in surgeries for that surgeon. The role that I have is called an inpatient team. So I do 12-hour shifts where I will go in, I'll round on patients in ICU, on the floors. I don't do any clinic with this position, but I do also assist in the OR when needed. And also see consults in the emergency room. So it's a little bit of everything, but it's not assigned to one physician, so to speak. You're kind of a general.
Yeah. So when you say assist in surgery, tell us a little bit about what that actually means. What do you do when you're there in a brain surgery or in a spine surgery? What would your role be?
So I think the main role is you're the extra pair of hands for the surgeon. So that means you're constantly helping them to visualize things, whether that's, making sure that the blood is out of the way so they can see the spine or brain tissue. Maybe you need to irrigate things. You need to assist in retracting things. Basically, any way that you can assist them and just jump in and be those extra pair of hands so they can get the job done faster and better. That's what you're going to be doing. And then when the surgery is finished, they usually let you close. So in a brain surgery, I'll assist in putting the bone flap back on and then sewing the galea and the skin back together for the scalp. Spine surgery as well, closing the fascia, the subcutaneous, and then the skin. And then, you're in charge of seeing them after the surgery, rounding on them every day, changing their dressings every day. So you're there just as, assisting them however you can just to get the job done better and faster.
Mm-hmm. Mm-hmm. Yeah, awesome. Yeah, it sounds like it's a very hands-on kind of a job.
Very.
Yeah. Now, when you are rounding on patients, what does that kind of look like? What do you actually do when you're doing that?
Okay, so when I go in the morning, we get the rundown from the night shift on all of the patients, and then we kind of divvy up the patients that we need to round on. So usually we start in ICU. We'll go to the surgical ICU and round on those patients. We go do neuro exams. We look at their drain outputs, if they have like a ventriculostomy drain, or an external ventricular drain, we'll look at that, the different pressures like ICPs, and this is neurosurgery, but other specialties have their specific things. So we're looking at all those things, doing exams, and then we formulate a plan. So after we've rounded on all the patients, then we go back. You have to chart all of those notes for all of the patients you've seen. And then you also are putting in orders. You're looking at lab values. You're looking at MRIs and CTs, X-rays. So you're doing like all of the major groundwork. And then we do talk with the surgeon, the physician, to finalize a plan before we end up initiating it. Most things you can do on your own autonomously, but the bigger decisions, of course, with neurosurgery, we do have to bounce off of the physician. But, all of the daily things and the smaller decision making, you're making those decisions. So you do get to practice somewhat autonomously, but you are also working with a physician for that each patient.
Mm-hmm. Mm-hmm. Yeah. And now let me ask you this. You mentioned earlier that you had been an RN, you had a BSN, and that you went into PA school, but that in your current work, there are both PAs and nurse practitioners. Now, why did you choose to go the route of a PA school as opposed to going the route of as a nurse practitioner?
Right. I know each state differs with responsibilities and independence with different roles. In the state of Texas, essentially nurse practitioners are equally as powerful as a PA, but I liked the PA school model instead. I think since I wanted to go into surgery, I think it better prepared me to be able to jump into that because it's part of my training in school, and you are able to first assist and bill for that. So it was very good for me personally to be in that model of education. I also felt it better prepares you because it teaches you all of these fundamental things in medicine that you need to know. In nurse practitioner school, they also do that just in a different way. They pretty much add to the education and experience that you already have as a nurse, but you are selected to have a track of whether it's family nurse practitioner or acute care. So you're not able to have as a wide variety of practice as a PA does. So graduating from school, I could go psychology, I could do surgery, I could do pediatrics, I can do clinic, inpatient, outpatient. You can pick any area of medicine that you want to work in. So I thought that overall it was a better choice because I was able to choose surgery and just jump right in without having to do a first assist program or any further training after I graduated.
Oh, nice. Yeah. Excellent. We had a question earlier from a student who was wondering about, trying to make decisions with regard to whether he was going to apply to PA school or medical school. And I'm just wondering, did it go through your mind in this process of maybe applying to medical school, or were you pretty committed to the PA route of things, or did you consider med school at one point? And if so, why did you choose PA instead of going to med school? Talk a little bit about that.
Sure. So I originally wanted PA from the beginning. I didn't want to do the 4 years of medical school. For neurosurgery, it's 7 years of residency plus 1 to 2 years of fellowship. So you're looking at 12 years maybe of training after your undergraduate work. So I liked the PA role best because you still get to enjoy some of the fun of surgery and, making decisions and practicing medicine, but you don't get the full responsibility as a surgeon or a physician does. So for me, it was a lifestyle choice where, yes, I do want to do this. I want to go to work. I want to have, a pretty good salary. But yet I don't want to have that full responsibility or that lifestyle that a physician has, constantly being on call, constantly answering questions and dealing with situations and being the final say-so. But if that's for you, then maybe medical school is what you should do. But for me, I thought it was better to be the number 2 guy. And, I would be there and be able to come to work, do the work that I love to do, and then I get to leave work. It's a shorter training program. It is a master's degree. So it's only 3 years versus however many years I said before, 11, 12 years to work in the same field. So for me, I thought it was the best choice.
Yeah, good. So we have a question from Christian. Christian says, can a doctor switch you from another surgical physician associate if he doesn't like the way you work with him or her, or are you stuck working with that doctor during your employment? So I guess, does that make sense? You understand the question?
So if the surgeon or doctor doesn't like how I'm working with him, he wants to switch to another one. Is that?
Yeah. How does that work?
So when you sign on to work with a physician, generally there's supposed to be like a collaborative agreement. You interview, you get the job, but then you and your physician sit down and talk about what is it that my role is going to be, what are the things that I can do, what are the things that I shouldn't do that maybe he or she should be doing. So you kind of iron out those things and it becomes like a working relationship at that point, which is why I think it's good that they changed the term to associate, because you are an extension of that physician, but yet you're also working alongside with them. So you develop that relationship with them. And if it does not work out, then, usually what they'll do is give you a grace period, so many days where you can find another physician to work with or another job, and vice versa. If you don't like the physician that you're working with, then usually there is a grace period for you to find that also. Mm-hmm. And I've dealt with that before. I mean, there are different personalities out there, and some people clash and some people get along very well. So just like any relationship, there's going to be this period of getting to know each other and learning your physician. I think that's probably half of the job, is learning how your physician does certain things and treatment modalities. So it's just a process of getting to know each other.
Yeah, yeah. Because you and I guess it depends a little bit also on how big the practice is. You know,
Right.
if there are multiple surgeons, then there may be opportunities to switch to a different surgeon. If it's
Right.
just a lone practice or whatever, you know, then more limited. But the bigger the practice, the more opportunities
Yeah.
that exist, I would guess.
And I have worked in different settings. I've worked in the hospital setting for a group of surgeons. I've also worked in private practice with one surgeon, both of which have their pros and cons. So it's just basically whatever fits best for you and what you think is comfortable with how you can work.
Now, tell us a little bit about your lifestyle. So you mentioned how you were really wanting to you know, have a lifestyle friendly role, job, and has it turned out to be the way you had anticipated it that it would be? Has being a PA, in your case a surgical PA, worked out the way that you had anticipated?
So far, yes, it has been good. I will say my first job was pretty hour intensive. I was working 60 hours a week, and so 5 12-hour shifts, but I still had my weekends off, never was asked to be on call for the weekend. So you know, when you're off of work, you are off of work, and most physicians will respect that and will not bother you. Especially if you're working like in a hospital setting with multiple PAs or APPs, you know, you're able to set your time of work, and then when you're not at work, you're not there. So other people take over and pick up those responsibilities. But yeah, I think overall it has been a good choice for me. Right now, I'm working in a hospital setting. I work 3 to 4 days a week for 12-hour shifts. So when I'm at work, I'm there, and then when I'm not, I have my own free time. So there are, you know, a few days during the week that I don't work, that I'm off, so I can, you know, kind of move those days around, maybe do a short trip here and there, or spend time with friends, or, you know, if you want to do certain hobbies, you have your own life that is outside of work. So I really appreciate that.
Yeah, that seemingly would be one of the real benefits of the life of a PA would be that lifestyle choice.
Right.
Yeah, absolutely. Good. Let's see. I just want to encourage the group. If you have any questions for Matt, surgical PA here in Austin, Texas, if you have any questions, chime in. We'll try to get to those as we go along. Matt, I'm interested in what do you think makes a good PA? What is it that what kind of personality traits or what kind of interests or whatever? What is it that makes a person a good PA?
So I think it's a few different things. I think one of the important things is being able to interact with people well, to talk and explain things. I've heard many times that, you know, people love to visit the PA instead of the doctor in a clinic or in a hospital, because we take the time to explain things, to relate to them. And I just think that to be, you know, that kind of warm and informative person who's compassionate and helping people, I think that goes a long way, as well as, you know, you have to be smart and pay attention to detail, and, you know, be able to critically think and problem solve. So it's, you know, it's more than just having the education down. There's also, you know, you have to be able to connect to people.
Yeah. Seemingly that's a big plus if somebody can connect with their now. When you were applying for PA school, it was very similar to the med school process, right? In terms of there was a common application that all the PA schools around the country use, or most of them use. And did you have to interview at the PA school where you were ultimately accepted?
Yes. So I got through the gauntlet of the CASPA application, and then I was selected for an interview for the program that I attended. So they selected so many applicants to interview in 3 or 4 different waves. So I was selected for one of those. They basically do like an orientation process of what their program is like, what their curriculum consists of, what the day-to-day activities would be, which basically is classwork and studying all the time. You don't really have much time for anything other than that in PA school.
Yeah.
But yeah, so they were able to talk about those things, and then you would go and interview either individually with some of the faculty members or with like a small panel of them. I really felt that my program was looking more at the person. Of course, you know, the education and, you know, things that would get you into the program, but also looking at you as a person, who you are, and, you know, making sure that, again, you have that that ability to connect with people. And I think that they picked a very good group of students with their selection process. So it was a full day of interviewing and getting to know the facility and the faculty.
Yeah, yeah. Now, shadowing PAs is really important for that process, right? If we were talking about this earlier before you joined us, we were talking about how important it is that students who are interested in applying to PA school have some really substantial experience shadowing PAs, so they really know what they're getting into and what the lifestyle is like and the work is all about. Do you agree with that?
I think it is important to do some shadowing. Before I applied for PA school, I did shadow a surgical PA. She was cardiothoracic PA, so she would scrub into the surgery. She would harvest the saphenous veins, get it prepared for the bypass. So it was really interesting to see how she had her own part of the surgery that she could do on her own, and also that the physician relied on her to do those things. So it was a good eye-opener just to see what a physician associate actually does on a daily basis. So you get an idea of what it is that you would be doing after you finish the program. And I know that some programs do require some shadowing, or they recommend for you to do some shadowing. My recommendation is to find out what those programs actually ask you to do and what they recommend to do, and I would do that. So if that means, oh, we recommend so many 100 hours of shadowing, I would do that. Make sure that you have all of those hours, because it is a very competitive program to get in just from the sheer number of applicants. So you have to be someone that stands out, and someone that I would also say get everything done early, not just on time, but get it done as early as you can.
Yeah.
Because it is a small window that you have to get through to get accepted.
Yeah, and PA school is pretty competitive. I mean, I think in some ways it's more competitive than medical schools, because the class sizes are pretty small. Is that right? I mean,
yeah.
How many were in your class?
So I actually had one of the bigger classes. We had 75 people in my class, but usually most programs would only take 35, 40 students each year. Part of that is because they also have to find the clinical sites for you to rotate through. So I think some programs are beginning to do bigger class sizes, but you know, out of 75 people in my class, I think there were at least 1,400 applicants.
Wow.
So, and then based on 1,400 applicants, they only accept so many for interviews, and then of course so many for the class.
Right.
So just sheer numbers alone, it is very competitive.
Yeah. And just for a shout out to your alma mater, you tell us where you went to PA school.
So I went to PA school in UNT Health Science Center, which is based in Fort Worth, Texas. It's an extension of the UNT system in Denton, Texas, and they had worked with what used to be a DO program. So they've merged and now have all kinds of various programs there, and I felt that it was a very good program to get my education.
Yeah, awesome. Well, Matt, it's been a delight having you here. Thank you so much for joining us. It's been great, and good luck to you with your work and the special things that you do for patients in the hospital there and stuff. And so, anyway, thanks again so much, Matt, for joining us.
Yeah,
Sure,
thank
you're
you,
welcome.
Matt. And maybe we can have you back one day since we had some tech issues today, so we can dig a little deeper with you if you'd be interested. Or pre-AP
Sure.
students, if Matt can't make it, we'll find someone else to try to
Yeah.
make up some of that lost time. But we're thrilled that you were able to carve us out in your day after all of our little hiccups.
Sure. Well, thank you for having me.
Yeah, absolutely. Thank you, Matt.